Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Welcome to another episode of I Am You. If you are new to this podcast, I am so happy to welcome you here, and I hope that you find something valuable in today's story. As you know, in this podcast, we have been taking the time to have meaningful conversation with women that have been in the journey in the healthcare system where they have been ignored, they are not being recognized, and have been suffering with conditions that have been difficult to understand what's happening. And they're here today to share this with us so we do not have to fall victims of a system, and at the same time to help us, our friends, our sisters, our mothers, to have a better quality of life. Today, I am delighted to introduce you to Miss Hannah Bunker. I'm so super thrilled, Hannah, that you're here today.
Thank you so much for having me. I'm really honored to be here and talk about everything.
Thank you.
Yeah.
Okay, so Hannah, not everybody's going to be able to see your beautiful face unless they're watching this podcast in YouTube. The ones that are seeing you, they see that you're very young. The ones that are listening to us have no idea how you look like. But why don't we start with how old you are and why are we sitting here today? How did you end up in my office?
Of course, absolutely. So I am 34 years old. I have what they call POTS, so Postural Orthostatic Tachycardia syndrome. Basically what that means is that when I stand up, my heart can't pump the blood as well as it can back up to my brain, which causes dizzy spells, fainting, amongst a plethora of other symptoms. So POTS is an overall syndrome that encompasses a lot of different symptoms that not many people think would actually work together. I actually started experiencing symptoms probably when I was about 16, 17. Didn't really think anything of it. Most doctors I spoke to ruled them out as individual symptoms.
By then, the beautiful definition that you gave of POTS, which is the easiest way of understanding POTS, you didn't know that you had POTS.
I did not, no.
So by then, you only had symptoms.
Exactly.
And then you were going to seek attention, explaining what you were feeling. And at that point, it was taken as isolated events. Yes?
Exactly.
16 years old.
Yep.
That's when you started having symptoms.
Very first time.
Continue.
So I was struggling just a lot, just feeling so confused and frustrated. It was definitely not a straight journey. It wasn't an easy path. There was a lot of frustration and self-doubt. So when presenting a lot of these symptoms, I had headaches, insomnia, nausea, dizziness, that fainting upon standing, which isn't always common for POTS, for people who have POTS. It's not always something that is, general amongst people with POTS, but for me personally, I did have those fainting spells upon standing, and bringing these up to my doctors, getting, for lack of a better term, blown off, saying that these aren't related. This isn't something, it's in your head. It's just being a woman. It's all of these different things that kind of made me doubt myself and made me think maybe it is in my head. Maybe I am overreacting. Time and time again, getting these same results from these doctors really took a toll on my mental health as well, which unfortunately exacerbated my symptoms greatly. And at one point in time, the worst of it, before I got diagnosed, I actually had to take a 6-month leave of work. I was calling out. I was missing important events with friends. I couldn't keep up, and it really started to affect me. And then eventually I had a great friend of mine who introduced me to you.
And before we get there,
before
we get there, I think that it's important for the audience to hear your story because first, I think that the fact that you were so young and that you are so young, we are so focused on age when it comes to cardiovascular problems that we can have somebody in front of us with symptoms that are typical of a condition that we can manage. Like in your case, you said, because you have learned so much. That's why, I love it because one of the things that I always discuss with my patients is like, once you know what you have, it just gives you power, not only because now you know that this is not just in your head, that this is real, even if sometimes is doesn't necessarily have a cure. POTS normally don't necessarily have a cure. Some patients can overcome POTS later on, but some patients, the majority of the patients just learn to live with POTS.
Exactly.
But you so eloquently describe that not every patient with POTS will necessarily pass out. And that is as you were studying and trying to understand your condition once you knew you had it, yes?
Exactly.
But if I'm lucky enough as your provider to come in front of a patient like you that is expressing these symptoms and I know what that is, then the patient that passed out makes it easier for us to think about, well, okay, what is causing this patient to pass out? And even though you were having those symptoms, it was still not recognized as the condition that you currently have.
Right.
So that's the point that I want to make is that heart disease doesn't have an age. You started at 16 with this condition, and they look at you. And of course, I have mentioned this in the past when I said, nobody wants to have a heart condition. And we do not want anybody to have a heart condition as providers. So when we see young patients, we're like, it cannot be. It's like, they tend to attribute this to everything else but the heart because they cannot conceive heart and a young patient together.
Right.
And we had to start eliminating that. Like, no, just because they look young or because they're young doesn't mean that everything is perfect with the heart. Not only because you can develop conditions like yours, but also because they're congenital conditions. People can be born with heart conditions, and we just have to be able to listen to them. How many doctors, if you can count, if you remember, how many doctors do you saw from the time your symptoms started to the time you got to my office?
I would probably say it's more than I can count on two hands, unfortunately. It was something that I was consistently pushing for and trying to find these answers and trying to just find an explanation. Obviously, like you said, no one wants to get diagnosed with these things. No one wants to understand if there is a heart condition that tends to scare people, and for me personally, not having those answers was really affecting me, and being able to get diagnosed with POTS created that language for me to get those answers, and most importantly, create a plan to help manage it, which I think is the most important part, not even going into the education part of it, which, as you understand, is extremely important as well.
And for many people, what happened is that I am so grateful that you didn't, although you're going to tell us how is it that you end up with me, but that, after seeing so many doctors, so many women lose hope and they start really believing that there's nothing wrong, and they settle for their okay life that they have. And, it's sad to hear that somebody like you had to take a leave from work because your quality of life, you couldn't do it.
Exactly.
You couldn't do it.
Mm-hmm.
Okay. So I also want to know, what did they tell you that you had? Were they really giving you diagnosis for every different thing?
Yes.
So they did. You did have diagnosis, but not the treatment did not make you better. Okay.
Yeah, they didn't really. I mean, they made sense at the time because they were my doctors. I was believing them, 100%. I was imagining that, as myself advocating for me, they were advocating for me as well and providing those proper diagnoses. And unfortunately, I was diagnosed with chronic migraines and started taking medication for that. Unfortunately, that didn't work. And then I had insomnia, so I was given medication for that. And so many different things tied together just wasn't quite getting everything. And before I knew it, I was, handfuls of pills and trying to figure out there's got to be a better way.
I am kind of like having a smile on my face because for the audience that have watched our documentary, and Robin is in that documentary, and she suffered from POTS, and just what you just said, she says it in there. It's like, I was treated for this, I was treated for that, they give me this, they give me that, but I was still not feeling okay.
Right.
And then, so for the audience, it's like, okay, so listen, if you're having symptoms that they seem to be like all isolated and you're getting treatment for this, and that, and you still not feel right, then you probably should want to question, perhaps, could this be POTS? It's like, so the question is not going to hurt. It's good to actually bring it up. For you, it was hard to bring it up because you didn't have any you didn't even have idea of the existence of
Exactly.
POTS.
I had no idea it existed until I met my best friend, and she was experiencing the same things. We kind of just cross-referenced our symptoms. She's like, have you ever heard of POTS? I'm like, no, I have no idea what that is. Tell me more. So, in this day and age of Google and WebMD and TikTok and all the social media that we come across, there is misinformation, unfortunately, but there's also more information for people to understand themselves and realize they're not alone. And so in finding her and her introducing me to you and getting that official diagnosis back in 2023 made me really realize that it's not in my head. I'm not alone. And it was a really big turning point for me, honestly.
So POTS is not a very common condition. No, normally the statistics says that about 140 patients from out of 100,000.
Right.
So if we think about it, it's a very small amount of the population that suffer from your condition, which makes it a little more challenging to diagnose, but also is the age. It's more commonly seen in young females, and normally young females that present with these symptoms, is easier to say that they have anything else, that they're anxious, that is their periods, that is like they're struggling at work or they're struggling in school versus identifying that they had that problem. So, it's so beautiful what you said, like somebody else. Sometimes we don't talk about illnesses. And that's actually one of the things that I love about having this opportunity to have conversation with you and so many other women is like, okay, so if we don't speak about this, then it's hard for other people to relate and said, wait a second, I have that. Right. So you and your friend started talking and she's like, wait a second, like, have you heard about POTS? Because she has POTS.
Exactly.
Because she has POTS. And then she ended up being in my clinic. And then after her diagnosis, then she could help others. And then when she heard the story, she's like, you need to get checked because it sounds like what you have is this. Yes?
Yeah, exactly.
And then like that, you become advocate for so many others. And today you become an advocate for, I don't know how many people we can touch with this, but I'm pretty sure that out there is a young female that it has been experiencing symptoms that nobody can explain, or a mom that is listening to us that have a daughter that nobody have been able to help her.
Exactly.
And with your story, we might be able to help them along the way.
If we can at least reach one, that's the goal.
So, did you feel that now, because you already shared with us how much this was interfering with your life. Now, POTS is a condition that definitely interfere a lot with the quality of life of the patient because you have a lot of non-specific symptoms. I'm not going to go into the pathophysiology of POTS. At the beginning, you introduced it very nicely, and you even said postural orthostatic tachycardia syndrome is a diagnosis that can be made. It's not complicated. It's actually easier than that people think of. It can be made in the office, but if we cannot make it in an initial visit, there's tests that we can do, like the tilt table test.
Right.
Some patients, we had to provoke the symptoms because when they come to the office and we try to provoke those symptoms, then we cannot unmask it. But then we do a tilt table test and then we can actually unmask that and see it. So it's not as complicated. There's not a lot of invasive testing that I had to do. But you did mention that the quality of life was so poor. Normally that's very characteristic of somebody with POTS, not only because of how they feel, but what they're afraid of. Yes, they're afraid of passing out. They're afraid of being alone when something happened to them.
Yes. There's many things that you're not able to do with POTS, unfortunately, and things that you had to rethink after you got your diagnosis to tailor your life to make it easier for you, to increase that quality of life and not feel so alone. And having that support system, of course, is huge, but being able to understand that there are things you can use to manage the symptoms and modify your lifestyle to, incorporate it into your life and hopefully not have those severity of symptoms anymore. Obviously, they're still going to be there. There's going to be flare-ups that come out from trauma, certain situations, of course, but understanding the POTS and understanding your symptoms, managing them better can really help improve that life.
And also help you to regain your life, empower you, and then be more confident.
Exactly. Yes.
So I think that like any time we make a diagnosis is the audience will be surprised that sometimes we are looking for a problem.
Right.
And although we don't want to find a problem, we want to find a problem, and the patient wants us to find a problem. No, because they're been feeling so bad for so long that even if it's something, just tell me that whatever it is, let's take care of it. But I want to know what is wrong with me.
Right.
So, and I think that the label definitely makes a difference, and particularly for those patients with POTS, knowing that they have a condition that is real that we can treat. Because once you start the treatment, which is also not very complicated,
Not at all.
it's just that it has to be, like you said, well, we normally start incorporating the therapy, and then we continue to work with the patient until they feel better. Yes, understanding that we might not be able to get rid of the complete problem, but it's just about resuming their life and recovering the quality of life so they can function with the condition. Yes?
Exactly.
And we do know that it's possible because, like you and your friend and many of the patients that we have with POTS, is possible once you know what you have.
Yes, exactly.
So I think that I'm not going to add much more about this, but I definitely want to invite the audience, the women that are listening to us, that if they are suspicious that they or any family member are experiencing symptoms like yours, no? So with POTS, the typical is, I feel that my heart races when I stand. Yes? That's the typical. Yes? And that's how we make the diagnosis.
Exactly.
You know, we are looking for a heart rate that goes up more than 30 points standing in the first 10 minutes without a drop in the blood pressure. More than 40 if the patient is between the age of 12 and 19. But the point is that when we're looking into if you know that you're experiencing tachycardia when you stand up, if you're passing out and you don't understand why you're passing out, if all of a sudden you're at work and you feel that your heart races and want to get out of your chest, or you're in the mall and you're like, why is my heart racing?
Oh, yeah.
I'm not doing anything right now. Then I want them to be suspicious of POTS. And I hope that this is the pearl that they take from you sharing the story with us so they can actually at least present it to the provider and said, perhaps, could I have this?
Exactly.
Yes.
Asking for those diagnoses, asking for those tests, making sure that, the people that you're speaking to are educated on it. Unfortunately, it's an issue right now where there isn't enough education out there. There isn't enough patient advocacy revolving around POTS in order for people to get those answers and to connect those dots. We need those helping doctors to connect those dots for us. But obviously, like you said, in hoping to get something like this out there for people and helping women connect those dots on their own and presenting their cases and just saying, hey, can you please take a look at this? And speaking up for yourself is important.
Yes. So be your own advocate. And I think actually if there is any moment that you have to be the CEO of your own health, is with POTS.
100%.
Because it's so complex.
It really is.
And you can be dismissed time after time after time after time like you were. And sometimes it wasn't for lack of caring. Sometimes it was for lack of understanding. No,
Absolutely.
they were trying to treat something that they were not targeting the problem. Yes. I am so grateful that you're here, Hannah.
Thank you so much for having me. I really, really enjoy speaking with you anyways. So being able to do it like this and share the information with everyone is so important. So I'm really thankful for it.
Thank you. I thank you. And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.